Well, good morning, and thank you, Mr. Chairman, for calling this hearing. Today, I'm thinking a lot about the children with complex medical conditions and their families. On behalf of the families across America who are faced with a complex condition that their child has, I want to thank everyone on this committee for moving the ACE Kids Act forward. It hasn't been easy. This has been a multi-year proposition. I've been working on this bill since the 113th Congress with Congressman Joe Barton has been the stalwart co-sponsor and sponsor here, along with our partners, Jamie Herrera Butler, Jean Green, Anna Eshute, and Dave Reichert. But the ACE Kids Act in this Congress has over 100 co-sponsors, bipartisan, including a number of my Energy and Commerce colleagues, and I want to thank them, specifically Representatives Cardenas, Clark, DeGette, Engel, Kennedy, Peters, Rush, Bilirakis, Costello, Guthrie, Harper, Lance, Long, and Olson. And I encourage our other colleagues to sign on to the bill as well, and thank you for your steadfast commitment to care for these children. We also have a number of patient and stakeholder groups supporting the ACE Kids Act that range from the Children's Hospital Association to the March of Dimes to the American Academy of Pediatrics and many more. Thank you all for consistently standing up for children with complex medical conditions. And I also want to take a moment to thank the committee professional staff for their dedication to families and the hours they've spent working on this bill in a bipartisan fashion, especially Rachel Pryor and Samantha Satchel on the Democratic side, and Josh Trent and Caleb Graff on the Republican side. Additionally, this bill would not be where it is today without the stellar work of my legislative director, Elizabeth Brown, and Representative Barton's staffers, Krista Rosenthal, Gable Brady, and Jeannie Bender. But it's really the families who are the heroes here. It's the families of these kids that have explained to members of Congress on both sides of the aisle how important it is to have coordinated care. I became an advocate for the children and families that this bill will help after spending significant time back home in Tampa at the St. Joseph's Hospital, Children's Hospital Chronic Complex Clinic that was started 16 years ago by a wonderful pediatric critical care doctor named Dr. Daniel Placencia. And the ACE Kids Act is somewhat modeled after the St. Joseph's Children's Hospital Chronic Complex Clinic and the 700 kids and families that they serve. But Mr. Merrill, you know, this is the idea of home health, a medical home for these kids is not unique. It's being done, and we need to take it to the national level. The families I've met with over the years have shared with me what they've gone through to get the proper care for their kids. The care that they were receiving was often fragmented and uncoordinated. But most importantly, we've got to focus on making sure the kids have a better quality of life. And we think through this bill, we'll be able to do that. Mr. Merrill, you might remember Tish West testified a couple of years ago, and she said, I met her daughter, Caroline, who's been treated at St. Joe's. She said, in the beginning of Caroline's life, I used to carry around these gigantic notebooks full of medical records and everything else so that we went from doctor to doctor. She'd have to explain what was going on and what her illnesses were. But at this clinic, at this medical home now, they have the medical records. They're all electronic. Everyone knows Caroline. They know what's going on with her. Tish said it's just a real collaborative effort, and she's much healthier as a result of that. Do you think we're going to be able to make progress for more families if we pass the ACE Kids Act?
I absolutely do. In our own experience in Texas with our STAR program, which is somewhat equivalent of ACE Kids, we actually have care coordination clinics and medically complex clinics that would mimic a lot of the structure that we're contemplating in ACE Kids. I would give you one example of just recently, as we have 9,000 children that are signed up in our STAR Kids. These are medically complex kids in the Cook Children's Health Plan. And so we took the most complex children of those 9,000, and our care coordinators for the first 2 weeks spent numerous times on the phone with these families and made home visits to these families to look at not only what their health care needs were, but their social needs. There was one particular example where the child and family had been for months and months carrying their child up the steps because they had no wheelchair ramp for the child in the wheelchair. We put a wheelchair ramp in for these families. And so this care coordination and this care plan it's tailored for these specific families. And when it's tailored, we're able to anticipate needs, not just their medical needs, but other social needs, and make it so much more easier for these families to navigate what can be a complicated system and help these children remain healthier. I'll just give you one more quick example. This was actually a couple of weeks ago. We had a mother of one of these medically complex children call her case manager. And by the way, these case managers, as you well know, have these incredible close relationships with these families. There's respect, there's great communication going on, and this parent was distraught that she was getting close to the weekend and she wasn't able through a series of events to get a prescription filled for a child that was much needed for that weekend. Called up our case manager. Our case manager calmed the mom down because of that relationship, took care of the prescription order from the physician, went to the pharmacy, picked up the drug, and delivered it to the home for this family, avoiding, by the way, an ER visit guaranteed and probably an inpatient admission. So that's the kind of activity that we anticipate under ACE Kids, the kind of work that will make life easier, but keep these kids healthier, keep them out of the hospital, keep them closer to home, and I think that's a very positive thing for these families and their children.
Thank you very much. And Mr. Chairman, I'd like to ask unanimous consent to submit for the record a letter from St. Joseph's Children's Hospital CEO in favor of the bill.
Without objection, so ordered. And the gentlelady's time has expired.